All right, good evening, everyone. We're just going to wait one more second until everybody gets in from the waiting room, but we're so glad that you all could be here this evening with our wonderful panel. First of all, I'm Susanne Killian, and I work with the Center for the Business of Health. I'm the healthcare lead with our brand new Healthcare Academy. But the CBOH is a wonderful organization. We're a center on campus, and we work amongst all students and departments that have anything to do with healthcare and the business of healthcare across campus. We're even reaching beyond the walls, which is very exciting. And we're glad you could be here tonight for our career networks. I'm going to pop our link into the message over to the right into the chat, just in case you haven't accessed our career networks in the past. Tonight's panel is one of our series of panels that we have throughout both the fall and the spring. We have panels that align with our verticals, but this year you're very fortunate that we're adding some interesting new types of panels and fireside chats. This is inclusive of our we have a new type of fireside chat where they're junior folks in a company that are going to interview their bosses or the senior people, such as CEOs. So we thought that that would be a great new addition. Also, we are going to have some diverse panels that aren't going to be vertically related, but are going to be related to preparation in your career, or even thinking about career switching, pivoting, so many other topics. But again, this is a series, so please go ahead and click on the career networks. We also have resources, materials, and contacts, in addition to the wonderful panel we have tonight, which will talk to you a little bit more about how to contact them later on. But after all of that, we just want to welcome our panel tonight, and I'm going to have each panelist introduce themselves. Again, this is under the vertical of healthcare consulting. But again, as many of you know, that is a very broad career vertical. And so we have folks from different backgrounds, different educational endeavors, and who can really give you some great tips about the career itself. So I'm going to start, and we'll go Sam, George, and Hill. So please introduce yourselves, and I am going to mute.
Hi, everyone. My name is Sam Hathaway. I am a managing consultant at Guidehouse within our commercial health payer provider practice. I've been there about 1.5 years now. I graduated from the MBA program in 2020, right after the pandemic settled in. And prior to coming to UNC, I worked for a software company that makes electronic medical records, doing implementation work for them.
Awesome, thanks, Sam. George Kernodle, I'm a federal healthcare consultant at Booz Allen Hamilton. Booz Allen is a large scale IT and professional services provider to the federal government. I think our portfolio of business is about 95% federal clients, inclusive of everything across the federal government, which also includes health, of course. My role there is to lead a couple of different projects and capture efforts in the interfacing directly with the Centers for Medicare and Medicaid Services, which I think many of you are familiar with in your educational pursuits and professional work prior to this. I'm a 2016 graduate of the MHA program at Gillings, and came to Gillings after pursuing education in religion and theology. So have a sort of entered healthcare through the side door, if you will. Had a pretty good experience at Booz for about 6.5 years now.
My name is Hill Winstead. I'm a consultant with the Chartis Group. We're an advisory firm pretty much focusing solely on the provider space, so not as much like Booz. I've been with Chartis for 3 years now, coming out of the MBA, MSPH dual degrees, so both Keenan Flagler and Gillings, so a little bit of a diverse experience there. prior to graduate school, I worked for one of the Blue Cross Blue Shield plans, so came from the payer side before that.
Terrific. And as you can tell, we have consultants here, so they were brief and to the point. If we were marketing folks, they'd be still speaking. So I appreciate the brief and informative introductions of yourselves. Again, as a career vertical tonight, one of the most important things I think people want to know are what are the steps that you have taken to land in your current career and actually in your current role. Again, people also move within the consulting arena. So can you all just kind of tell us a little bit about those steps and how you got to where you are now?
Yeah, why don't I start? So I was not originally interested in consulting. I thought I was going to go more to the provider space when I started my education. But when I was at Gillings provides great exposure to all of the various aspects of healthcare that I think make the healthcare system or healthcare systems, however you want to talk about it, work. And through that, I had some great experiences. I did an internship in the provider space with someone and sat in an executive office in sort of a BD role at a hospital. Really enjoyed that work and thought I was going to return to that. However, when I got back to school, consulting firms, are on campus and frequently sort of seeking out the UNC students because UNC students are so bright and capable. And so interacted with Booz through university recruiting, had some networking that allowed me to get to an interview round, and then ultimately ended up there. And I've stayed there because the experience at my current employer continues to draw out sort of the best efforts of many people that are like me. It's given me a lot of opportunities to continue to grow in my career.
Great, thank you.
And I'll just sort of echo George. I too was on the not so focused on consulting coming into school. I was actually thinking more health policy, but through going to these type of events and on-campus recruiting events really came to find that healthcare consulting in particular provides this sort of interesting intersection of the policy arena and understanding sort of the governmental aspects of healthcare as well as the business side of things. And I feel like one of the few areas where you can really kind of get exposure and work in both of those spaces. So going through that process, understanding the more sort of policy focus from the public health school and marrying that with the business school focus is really sort of what brought me to this path and Chartis in particular, because I feel like unlike a lot of other consulting firms in the healthcare space, probably we're focused solely on the provider space. We don't do life sciences or anything like that. So it's really a unique space to go and have that opportunity to maybe not be the folks in the C-suite like George was in his internship experience, but to be sitting there with them and advising them, it's an excellent opportunity.
For me, when I came to UNC, I didn't know that I wanted to go into consulting either, and I actually thought I was going to be more interested in the energy industry than healthcare. But during the course of my studies, I kind of came full circle just because I think the industry is so interesting. From a consulting standpoint, I didn't know that consulting offered this, but I knew I wanted to be in a career where the work consisted of a lot of collaborative problem solving. And through some of my involvement through programs like the STAR program, I really got to experience that and kind of naturally gravitated towards the industry.
Awesome. Terrific answers to that question. And if I may build on that, because it sounds as if maybe none of you came in with a thought of diving into consulting. Was there something that kind of surprised you as you started exploring consulting that drew you a little bit more to that vertical?
I'd say for me, it was the variety of work that you can do within the consulting space. So I think so often, as you're in business school and you're looking at, very specific types of jobs, product management jobs and things like that, that are that tend to be pretty narrow in terms of what you're doing on a day-to-day basis or consistent in that. The opportunity to go into consulting and see really the full breadth of the industry and work from, in our case, name brand national healthcare systems to, county funded safety net hospitals, and really understand everything in between is pretty unique to consulting. I think that's really what drew me to it.
I would say for me, it was the emphasis and value placed on the interpersonal side of our work. I've always thought of myself as a relatively technical person. I used to work for a software company, but coming to find that actually what I value more so than the technical problem solving aspect actually is the interpersonal side of things. You'll hear a lot of the consulting firms talk about how it's a relationship business more so than anything else. And I think that that's very true.
Nice. Thank you.
Yeah. And Susanne, I'll just add to that with a slightly different take. I entered consulting because I didn't quite know what else I wanted to do. And I thought consulting left the broadest range of options available to me at the end of the tenure. And so I think, like many people, I was interested in consulting, but not committed to a life of consulting. I was committed to continuing what I was doing in graduate school, which was this collaborative problem solving, interesting engagement, everything that Sam and Hill said, but doing that in search of what I wanted to do for a longer term. And I thought consulting, of course, gave me the chance to see more of that, and then get necessary experience to be then qualified for the positions that I wanted at the end of my tenure. So it's a great, consulting provides a great path for folks that aren't set on what they want to do next. And I would imagine that everyone on this panel has sort of experienced that angst. And consulting allows you to do a lot of things, including getting compensated well for your work while you figure that out.
Actually, that reminded me to go back to one of the things that Hill said. I think one of the reasons that I like consulting as an industry is my professional attention span is not particularly long, and it's nice to have the opportunity to hop from different engagement to different engagement.
Terrific. Those are terrific answers. And again, it just kind of brought us a little bit more information about your choices, and that sometimes it's okay to go in to an MBA program or into a university program, not really knowing exactly what you want to do, but this exploration piece can help you kind of refine that. So my next question is more focused on the skill sets. So what skills, abilities, and experiences do you use regularly, most often in your career? Again, students will read, oh, this is what you do as a consultant, but what do you really do? And what do you use most?
Yeah, this is fun. This is a fun question to answer because I do think the perception of what consultants do and their reality is quite different. When I was in school, I thought most likely consulting is an extended case competition where I get this like really clean data set and this awesome problem. It's exciting, and then I deliver the results, kind of like what you see on TV and in sort of the TV version of consulting. And the skills that I really thought I needed were the standard toolbox of consulting skills, and I'd say you absolutely need those things, but those are the baseline, not that's not how you become successful as a consultant. So in my role, I started with a job that was very similar to that. It was started as a data analyst. I was not a data analyst, but it was an opportunity just to contribute to a project. Eventually became the team lead, but the reason that I was able to traverse that experience was because most of it comes down to, are you dependable, accountable, and predictable for your leadership? So I think most people are looking for consultants that make their job and their life better or easier. And I think that's the skill on day one. Now that I am in more of a people management role, leading a larger project, the skill set's very different. I'm looking for the same thing in those folks. And certainly from where we recruit as a firm, we assume that they have that a case competition skill set, that everyone on this call in attendance here would have that skill set. But now the skills that I use are much more about trying to influence people. So trying to manage people, influence people, and then risk mitigation. which is largely about sort of keeping the parameters of the project on track and on delivery. So that's a long answer to a pretty short question, but that's sort of where I come out there.
It's probably worth noting that the skill set that you are going to be relying on will change, to George's point, throughout your tenure, and where it might be a little bit more Excel or PowerPoint heavy as a more entry-level consultant, which, by the way, anybody in the audience in the MBA program, try move heaven and earth to take the Excel class if it's still offered. It's phenomenal. And then as you sort of rise through the ranks, you come to be more reliant on those soft skills. And I think my initial answer to this question before hearing George say that was that active listening is probably the skill that I use more often than anything else. You know, my primary sponsor on my main engagement right now has been with this health system for 45 years. So I'm not going to tell her anything about that business that she doesn't already know. So it's best for me to just kind of shut up and listen as much as possible.
And I agree 100% on sort of the table stakes skill set. But to build on that, this isn't maybe necessarily a skill as much as an attitude. I'd say the other thing that's just so essential in this job is a comfort with ambiguity and an ability to kind of go out and find solutions to problems on your own. And I don't mean that just in the traditional like case sense of solving what the big problem is, but understanding, you know, if you're trying to do a market assessment or something like that, trying to find out what data is available out there and how to leverage that and really use it, but also being comfortable with your own sort of skill set to know when you're getting out of your league or you don't know the answer to something and who to go to and how to kind of bring that professional humility to reach out to the resources that you need as well. It's a very, very critical part of the job.
These were, again, terrific answers. And a lot of what I think everybody needs to do in many careers. I love the active listening. I really like the part of relationship building and how things change throughout, you know, as you move through your career, and how those build. So I'm going to pause here and see if any of our audience members might have any questions. Again, you can unmute and you'll kind of come to the front, or you can raise your digital hand. Just unmute and shout out your question, always works. Oops, I saw a digital hand come up, and that's Ishan. Hey, how are you?
Pretty good. Thank you all for taking the time. So you mentioned STAR, you mentioned the Excel course. What other advice would you have in terms of things we could do in the program to help set ourselves up for success?
And are you in the MBA program? Sorry.
Yeah, I am a first year MBA King Flagler student.
Gotcha. I would seek out opportunities. So if you don't have a consulting background, I would seek out opportunities to determine if this is actually a type of work that you would like to do. The STAR program was great for me. I came in knowing that I wanted to do it. There is some additional coursework. Overall, I would say that the consulting career track in particular does a very, very good job of being regimented about getting you the requisite exposure to the type of coursework that will prepare you well. So I don't think that you need to do significant additional coursework outside of what the career track already lays out for you. But I would suggest that there are opportunities that you can seek out to engage in that type of work, even outside of that framework. So you can work with, for example, many of the professors consult with the university. You can talk to them about joining a small team with one of them and doing some work, might even get paid for it during your time there.
Sean, it's a good question. If I could just jump in real fast. I can't speak to the MBA program because I obviously didn't attend the MBA program. I can speak to STAR because I think it's a great program. I have been a faculty advisor for STAR and highly recommend the experience of STAR. So I'd say definitely that. But the thing that I would really impress upon each of you is Susanne and team have created, and Susanne, Aaron, and team have created a network of folks that are at your disposal. If I were a student today, I would contact every single person on the Career Networks panel, and in that sort of book of contacts, because the best way to learn about healthcare is to talk to the people that are actually in it, and they can tell you a lot and give you a lot of perspective. And in addition to that, you can find someone whose work and values align to yours, and I think it might give you some certainty on the path. For folks at Gillings, I think Jeffrey is the resource. I would certainly, of course, participate in CBOH and take advantage of those resources, but don't also neglect what Jeffrey can do in the HPM space at Gillings for connecting you through the alumni network there. There's an alumni advisory council that I would highly recommend as well.
And even beyond just the alumni network opportunities, and this applies for folks at Kenan Flagler as well, as think about the courses you can take and the experiences you can get at other schools at UNC. So if you're a Kenan Flagler student, you can go take courses at Gillings, and there's some really, really phenomenal courses there in health policy and management that George and I can both attest to, that are worth taking the time to go see. But get involved with those, interact with people from the schools of pharmacy and dentistry and medicine, and get as many opportunities as you can to interact with people in different elements of the healthcare ecosystem.
Seconded.
Terrific. Thank you so much. And before I get to our next hand up, we have a question in the chat. How does the healthcare consulting interview look? How many cases are solved during an interview?
It's a good question. It's going to vary for each of our organizations, is what I bet. I'll tell you about mine. We don't use a case format. We use sort of more conventional interviewing. So you shouldn't expect any cases. You should, on the other hand, prepare to present the value that you bring to the organization and can bring as a person, student, etc. So that's ours.
For our organization, we do case, but they're not actually healthcare specific cases. Most of ours don't involve healthcare. So there it's more about the process and your thinking. But the complement to that is when it comes to the behavioral interviews, that's where we're really looking to understand, why healthcare, that, this isn't just consulting because we happen to be a consulting firm, that you're looking specifically to do something in healthcare in the provider space.
We have a couple different varieties of cases that might show up in our interview process, depending on what level you're coming in at and which industry vertical you're looking at. So for healthcare, we use some combination of an Excel-based case and a sort of PowerPoint-based like presentation type case that they'll drop a data set off and you make a presentation for it. We also do a lot of the standard behavioral stuff. And I would echo what Hill says, that if you have directly applicable skills and experiences, great, we want to hear about that. But many people don't, and that's totally fine. What we are looking for in the interview is to understand how your skills and what led you from that disparate experience to healthcare consulting, and also how the skills and experience that you do have are transferable to the type of work that we do.
Terrific, thank you. And transferable skills are extraordinarily important, and to be able to communicate those and your values. So thank you so much. So we have Sager, he's got his hand raised.
Hi everyone. Yeah, thanks for the time tonight. Just a quick question from a more strategic level is, I know you guys may be coming from different firms, but really, are there any kind of industry trends or common issues that you're seeing at clients that we can kind of start to prepare for if we're looking to be in the consulting space, whether it be maybe trends for more digital work, maybe is it more the use of tools like Tableau? What are we looking at, and how can we prepare?
So
yeah, go ahead, Hill. Sorry.
I was going to say, maybe not necessarily at the skill set level in terms of Tableau or things like that. Obviously, Tableau is very important, and I would say that's definitely something to learn while you're in school. But in terms of industry trends and things that we're seeing, we are on the provider side seeing a much bigger focus on value-based care, and looking at organizations transitioning from, sort of the old-fashioned fee-for-service, production-based models to looking at how they can transform to succeeding in population health management, value-based care, and those sorts of things. So I would say really spending the time to understand what that looks like, because ask 10 different people, you're going to get 10 different versions of it, but really understanding sort of where the payment models of healthcare are going.
Yeah, and I'll speak, my work is in the federal space. And so I think what we're seeing in the federal space is lots of wide ranging digital transformations. And so a lot of folks are going from what essentially is, they're basically doing cloud migrations, if you will, and then having to set up the enterprise architecture to support that infrastructure and then work with that. So we're seeing a lot of like analytics in the cloud, things like that. I think generally what we see is that the static work environment is moving to a much more dynamic work environment where no longer is it just sort of acceptable to bring analytics in your solution, but I think your analytics have to do more than just provide some sort of basic insights. So I think what I would say is, folks that are interested in digital stuff, like digital is the big ticket item in Fed consulting, but it's also transforming everything that we touch, including on the provider side too. So I think I would expect to see more of that, and folks that are pursuing exposure or skills within that area are going to be very marketable.
I would say my take, I don't have too much to add, is really that the pandemic, in my mind, mostly accelerated a lot of the trends that Hill and George talked to that were already happening, more so than it rerouted anything or shifted the tides in any way. I'm also, I have a bit of an IT bent to the work that I do, and the two big buzzwords that we heard for the past couple of years were integration. The big buzzword we're hearing now is automation. So if you can figure out what those trends actually mean, you'll probably be in a pretty good spot.
Terrific.
Thanks.
And we have another question in the chat. So for those with a consulting background but no experience in healthcare, do we need a strong story about why choosing healthcare as a vertical industry? And also, do we need to attend the electives in the healthcare industry in addition to that consulting track, as you already mentioned?
So I'll speak for Chartis and say that we do really want to see a pretty compelling story for why healthcare. Our organizational mission is to materially improve healthcare in the world. And so that's a kind of the fundamental undergirding for everything that we do. And so we want to see people who have a clear articulation that, it's not just consulting, it is specific to understanding the challenges in the healthcare sector and how to address that. And to that end, I think it's beneficial to take a lot of the healthcare electives. If for nothing else, then it gives you a serious leg up on learning the language of healthcare, learning all of the intricacies and complexities, because it's a business, but it is a business unlike any other. I mean, it is very much its own beast. So it's really, really helpful to take those courses to get up to speed on that and kind of change your thinking into the healthcare world.
Yeah, I'd say my opinion, not the opinion of Booz Allen, but I'm interested in your story of why healthcare, but I'm more interested in can you speak the language of healthcare, and do you understand what is being said and what the implications are? So if you have no industry experience, that's fine. I think, I actually think I'm all in favor of folks coming in from the outside. I think a lot of our greatest changes are going to be driven by people not in healthcare currently, but coming from other areas, bringing their innovations to healthcare. So I'm totally in favor of that and see the value of that. I do think there is a baseline requirement to be able to understand what I mean by Medicare, Medicaid, what I mean by value-based care. The simple terms of healthcare are table stakes for engagement.
My answer is the same as both of yours.
Terrific. And then I think that answer would encourage students to go beyond, and that the fact too that the MBA is so flexible that you can take electives in multiple areas. So and additionally, your co-curriculars. I think being here tonight is one, interacting with peers. I think, as George mentioned before, get in touch with all those folks on our career networks, because then you can start learning the buzzwords, the key trends, because we all know that these are so dynamic and change every day. And we have another question. So Lucas.
Hey, thank you again for being here. My question is, I've been told that I think a lot of the appeal for consulting for me is kind of the variety of problems. But I've been told in general in your career, it's always good to enjoy the bread and butter. So my question is, what is the kind of bread and butter problems that you work on day to day?
Let me take a crack at that one. It's a meaty question. So for myself, I think you'll find that within each of the consulting firms, there are sort of smaller sub-tribes that tackle different types of things. And each of those groups is going to bring expertise in a different type of solution. So for me, I work in Guidehouse's financial solutions practice. So most of the work that I do is not around necessarily clinical operational improvements, more back office function in finance. So our work is around a lot of value-based care and managed care contracting. It's around managing denials and other aspects of the hospital revenue cycle. We do have a clinical team who has expertise in those spaces, a lot of doctors and nurses and folks like that in those groups. But I think that if you want to have that diversity of experience, it would be available to you even within a firm that has a very targeted set of nominally targeted area of expertise. You should be able to find that diversity of opportunity as long as you are entrepreneurial about it and willing and able to advocate for yourself.
And I'll follow up with that to say, think about the scale of the firms that you're looking at as well. So Chartis is a little bit smaller than my peer firms here. We're about 500 or so employees. And as a result, we do have several different verticals, but within our strategy and performance practice, you have the opportunity to work on a really wide variety of projects. So in my time, I've done everything from private equity due diligence type work to M&A projects to doing some of the clinical operational improvement type stuff that Sam was talking about they offer in one of their other practices. So there's an advantage to going to smaller firms in that sense, where you do get the opportunity to jump around to some of those different things. So there's a lot more bread and butter, as it were, in some of those firms.
Hey, Lucas, is the question about the tech, like the specific area that we focus on, or do you want to know what we do during the day? Which one?
I think more so kind of the area you focus on, like the big scale problems that you tackle.
All right. Yeah. Okay. I thought it was. So I'm in the health tech space. We support, we have a decent sized project that supports policy development related to a couple of key initiatives that I'd say are front page news for the most part. And then we do implementation of or scope implementation of a couple of technology builds, including things like APIs that support data sharing and a couple of other things. And then in addition to that, I'm responsible for a territory, if you will, a sales territory. So I have a growth goal in Medicare. So focus on the Medicare program, providing support to the critical mission over there.
Awesome, thank you. All right, so we had another question in the chat, and that was from a student who is inquiring about international student opportunities within the consulting space.
Is
Go ahead,
there
Sam.
is there more specific question there?
More
Or just-
contact. Yeah, and actually, I think if the student would pop in and add anything, I think the student had some US experience, but I know that in a number of other verticals, there are limitations to our international students who do not have permanent work authorization. So I think that may be at the root of that question. And if it is not, please pop in a student and ask. I think it was Hamadri. So again, too, you can pop in if you would like as well, if I did not clarify that.
Yes. Hi, can you hear me?
Yes.
Yes, that's the exact question I have. So I do have experience in US healthcare consulting, and I wanted to know what does the landscape for international students look like in terms of sponsorship? Yeah, that's the exact question.
Great.
I think my perception is that it's more firm specific than it is industry specific, and that if you're looking for sponsorship, you're going to be best served, I would guess, by targeting some of the larger firms in the space, like your Deloittes and your PwCs. That being said, it should be the information should be available to you on 1220 to indicate if a certain employer does or does not offer sponsorship.
Yeah, if I could,
Thank you.
if I could just add to
Yeah,
this,
please.
Hamadri, the international student experience is very challenging, and I'm very empathetic to what that experience is like, having never gone through it myself, having seen many talented folks have difficulties obtaining the right work authorization. So first of all, I'd say from all of us, like, we welcome your contributions, and we think that it's incredible that we have the opportunity to work with you. So don't let the process be an impediment to pursuing employment at the place that you want to work. And I can't speak for our firm, but we are fortunate to have a very diverse firm made up of folks of all nationalities, backgrounds, skill sets, and races. And I think we are better for that. And so I'm certain that we have processes to support international students that want to work at Booz. But again, I think it's twice as hard if you're an international student, and I really appreciate the effort and work that goes into sort of beating that process. And you certainly have our support.
Thank you so
Terrific.
much, George. That was really helpful.
Absolutely. So thank you all. And again, too, for international students, these relationships are paramount. So the more folks you talk to, the more information you can get. I think that would really help you out a lot. But first of all, thank you, audience. These are such wonderful questions. I'm thoroughly impressed. So I am going to skip back to one of our moderator questions. And I kind of skipped one because I think that we covered it. But one question I always like to ask is, are there skills or experiences that you wish you gained in your education or in just kind of like your life experiences up to this time that would have helped you most in your career?
Well, I don't know if it would have helped me most in my career, but I will say the one thing that I regret not doing is actually something that Hill and George mentioned earlier, which is trying to pursue some opportunities outside of the MBA program that I was a part of while I was at UNC, whether that be Gillings or one of the other colleges at UNC. There's such a diverse ecosystem of opportunities available to you that if you do a little legwork, you can find some really, really interesting stuff kicking around out there.
Hill, what's your answer to that?
It's a great question. You know, it's almost the compliment to Sam's, where I feel like I spent a lot of time taking a lot of those interesting courses and spending time kind of learning about all sorts of esoteric aspects of healthcare that have been tremendously helpful. But if that's your experience so far, that's the experience you're thinking about, I'd say, you know, it's always critical to make sure you've got those sort of core consulting skills really, really refined. I know for me, that was an area that I probably underinvested in, particularly early on in first year when I wasn't thinking about going into consulting. And so that's really one of those times where if this is a path you're thinking about, it's always great to try and get as much exposure to those core skills as possible while getting that diversity of education, both at Keenan-Flagler and up the hill.
Yeah, it's good. I would probably do something in computer science or data science, or in some heavier finance. I think there are a lot of interesting opportunities. They don't present themselves every day, and they may not present themselves in the company I currently work for, but I think long-term, those skills have a pretty strong trajectory and lead to some pretty interesting career paths. So I'd say generally, the way I think about it is that we are, because of COVID and because of generally just how education has changed, I think we are going from an era where where 2 skills was enough to be a consultant and a healthcare person. Those were great, and you had a ticket anywhere. I think now what we need is a 3rd skill, which is, you know, to be a healthcare consultant that does X. And I think we look for that in the folks that we hire, but I personally wish that I would have invested more time in that 3rd skill versus trying to succeed in things I already was decently capable of succeeding at.
Oh, these are fascinating answers and something for students to really chew on as you are diving in to your education and or thinking about you know, expanding it. So thank you. I know we will probably have a number of students that will be pivoting, not necessarily students just that already have consulting experience, but will be pivoting into healthcare. But what do you suggest for, you know, those students or folks like yourself who may have no idea at this point in time? Are there steps other than like kind of creating relationships, talking to other folks that they can take to really get like that real feel? Like, I know you said, try to see if this is for you. I know when sometimes you ask folks like, oh, you know, what do you do? And people kind of sugarcoat it a little bit. How do they find out the real deal about what they will do day in, day out, and what that life will look like?
An excellent question. Not sure I have a great stock answer. I think some of the stuff that you've been talking about already, Suzanne, just around trying to reach out to alumni who work at various consulting firms and just talk to them about what they do on a day-to-day basis. Everybody's going to have different answers for you. There's not one template answer that's going to fit the bill, but I think that if you speak to enough people, you should get a fair sense of what it is that you're going to be doing on a daily basis.
Terrific. Do you feel that there are questions you could ask to really get at the meat? Sometimes I think we ask questions that are a little bit too high level to kind of find out about that specific you know, company or something of that sort, since they are very different.
Yeah, so okay, there's 2 ways to sort of channel this, I think. The first is a question to yourself, which is, do I want to work in professional services? And professional services is what consulting is. And that means that clients are paying you in exchange for some service in return. that usually puts you on a clock, on a time clock. And so, for instance, if the folks here, I would imagine both these other guys are on a clock as well. If you take a doctor's appointment, do you have to make up the time that you missed to maintain your billability? These are good questions to ask folks to understand what it's like to work for clients versus what it's like to work for a corporation. I think it is important for folks to really understand what is expected of you when you work for clients, and the particular pressures that are on you as a consultant, but also on your bosses, and how those pressures manifest on your life. And so, you know, I think some of the critiques of consulting are spot on. Some of them are avoidable, and you can sort of mitigate them yourselves. But I do think it's important to really ask yourself, do I want to work for clients and be subject to client feedback on each and everything that I do, including client timelines and potential changes of direction and lack of ownership of the final product. Those are things that you don't think are important, but 6 years in can grate on you in a way that some people end up leaving and some people end up just cherishing. So I think that's the first thing. The other thing is, I would really ask people, what are the pressures that you feel? Consultants typically have delivery targets. They also have sales targets. That manifests usually in more than 40 hours of work per week. And I think for everybody. And so I would be interested in how folks manage the pressure to further their career in their organization, and whether the path is available, they feel that the path is available to them and understandable. Those would be kind of what I would be interested in at this point.
Terrific, thank you. Anyone else want to contribute? That was pretty, that was a pretty full answer.
So I'm a consultant. If you talk long enough, nobody else will have comments. So that's the gig there. Go ahead, Sam.
I was also going to say, like, if, you know, doing that sort of research, if you're unfamiliar with the industry and the type of work, is a good way to help craft your answer to the question of why do I want to work in consulting? And I think if you do the requisite amount of legwork, you should have a pretty true answer to that question if you really understand the type of work that's being done there. And I think, as I mentioned earlier, if you come from a different background and you're able to articulate how your skills and experience are transferable to that type of work, that's a good indicator to someone like myself who might be interviewing you that you understand what we do and that you'd be a good fit for the position.
Terrific, thank you. I'm going to put it out to our audience again. Do we have any questions before our last question of our panelists? All right, John.
Hi, thank you guys for being here tonight. My question is just going into recruitment, how would you say we should evaluate different firms to kind of aim for?
So there's a number of different ways probably to answer that question. Let me say two things, and I'll turn it over to my fellow panelists. One is that you want to prioritize recruiting at firms that are a good fit from a profile perspective for what you want to do. Now, that may mean that they have an industry focus within healthcare, like Chartis, which is very focused on the provider side. It may mean that you go somewhere that has a heavy federal practice, like Booz. You also want to consider things like firm size. One of the reasons I like working at Guidehouse is because it is a big company. It's like 14,000 people, but our practice is very small within it. I think it might even be the same size as Chartis's practice. So there is more of an opportunity to be entrepreneurial. And that sort of profiling of the firms can help you pick apart the differences between, for example, the big four firms, which can seem very, very similar much of the time.
Yeah, and I think the other big piece of kind of profiling those firms is really understanding the culture, and kind of speaking to what George was talking about earlier, sort of what is, you know, the work-life balance aspect of things, or sort of how does your life integrate with the work. So particularly now after COVID, you know, what does travel look like within those firms? That's a really important thing to think about. But also just understanding, you know, are there opportunities for those really close mentoring relationships with senior leaders? Do you get the opportunities to interact with folks across different practices? Really just understanding what's the general culture and zeitgeist of any particular organization, and also looking at sort of their mission, vision, and values, and how well those align with you as well.
Yeah, I agree with what's been said. John, don't do it like I did, which is I started with these firms whose name I knew, and I was like, they're the best, definitely got to work there, and then got rejected from all of them, right? And then next tier, they're the best, got to work there. I think that there's an impulse that is almost fostered at school where you feel like you have to compete at some predetermined highest level. I would sort of be more self-aware to what Sam and Hill have said about what you want out of your career versus trying to align to what like looks the best on your resume in other people's eyes. So and if you're going to get turned down. So I think you just got to get over that. Like you got to give yourself a wide enough berth to feel confident that if any of these opportunities come through, you're going to have a successful career, and this is the start of something good, and your life, it's going to help you achieve your life goals. So I don't know if that's helpful, but the pressure to just like go to the top firms, I think is somewhat manufactured and not realistic in terms of aligning to your goals, even though we'd all love, I'd be happy to go to the top firms just as well. So.
Thank you.
Right. Terrific advice. And again, too, thinking about culture, mission, vision, and thinking about you and your fit in your career. This is not just your only step. This is your first step in a career. So this is fantastic advice. So I am, as we're getting close to the witching hour here, this is a kind of fun question that we've developed over the past year that people really seem to like to answer and students enjoyed. Do you have any podcasts, books, newsletters, websites that you would recommend that, again, help you in your professional life or that are just exciting to you, as a person out there in the career world?
The publication I probably read most often that's industry specific is Becker's Hospital Review. Mm-hmm. I think that's a good sort of newspaper-esque resource to avail yourself of every morning just to stay abreast of the various trends. I don't know that I have any healthcare specific podcasts that I listen to, but Becker's is probably my general news source for industry stuff.
Yeah, I'll second Becker's. It's fantastic, but I'd also say on the policy side, I tend to keep a pretty close pulse on health policy as well. So a couple great resources there. Politico has a really good health policy focused daily newsletter. Politico, I think it's Pulse. The Kaiser Health News is also a fantastic organization to get really good health policy focused reporting, as well as other healthcare type reporting. They have a great podcast called What the Health with some of their congressional correspondents, and they get a little weedsy on things. So, if you want to talk about like 1115B waivers or things like that, that's where you can start to really dive in on those. And in terms of books, I think if you have trouble sleeping and you want to learn more about why American healthcare is what it is today, anything by Paul Starr, who's a sociology professor at Princeton. He's got two. Remedy and Reaction is a really good one. And then The Social Transformation of American Medicine is fantastic. They're also great sleep aids. They're very dense, very academic, but excellent for understanding the context of American healthcare.
Yep. Social Transformation of American Medicine is probably the most informative book that I've read. It's about 700 pages, so you really have to dig in. It's about how power dynamics, largely at the turn of the 20th century, shaped the world that we live in today. I think it's fascinating. I haven't read the other book, but his approach, sort of structural look at healthcare, really makes all the pieces fall into place. But generally, I'd say I don't do a lot of reading and podcasting about healthcare. I didn't get a lot of that at work. I do more Netflix, and I think Michael Lewis is a great author. So anything by Michael Lewis is just golden to me. So you got to have that balance.
Great. And I'm sure Netflix has some good documentaries on there as well that might contribute to some understanding or some biased or unbiased understanding, or at least a few laughs. So
but watch the shows first, Suzanne.
There you go.
Watch the shows first.
That's it. And again, too, enjoy, you've got to enjoy a little bit as well. Because, healthcare is, it's heavy, it's big, it's dynamic. But as you can see that there is joy, and folks find joy in their careers, and also, as they move along and transition, which we hope that you all will start digging into that exploration of what your next step might be and what you can do to prepare for the next decades of your career. But I want to thank our panel, and again, taking the time. These are busy, billable people that took this time to be here with you all tonight. And we have many fabulous alumni, not just from Kenan-Flagler, but across the UNC community that we just thank so much for being our partners. And we hope that you all will thank them. You can email Erin Leach. And first of all, she just put her email in there if you would like to connect with any of our panelists. So I'd like to thank Sam, George, and Hill for joining us tonight. And please reach out to them. They gave wonderful advice. And I can tell you, in being in this game for a long time, that they are telling you the truth. So please connect. This is relationship. This is a community. Friendly folks in healthcare. We just hope that you guys take the advice and jump in and become part of our healthcare community as well. And don't forget to find out some of the other wonderful panels that are coming up, as well as the events. And we have the healthcare boot camp on Friday. So please go on the CBOH events page, and you can still register for that, and you will learn a lot more about not only healthcare consulting, but many other verticals. So again, thank you so much to our panel. Everybody, please have a good evening and enjoy this beautiful, well, at least here outside of Chapel Hill, it's a beautiful weather tonight. So thanks again, everybody.